Hi, I'm Grace Gahan, a speech-language pathologist at Craig Hospital's Assistive Technology Lab. As a speech-language pathologist in the tech lab, I'm largely working with augmentative and alternative communication, or AAC, which essentially is any form of communication that someone might be using when they're having difficulty talking. I'm going to show you in this video some low-tech communication options that we're often using here at Craig for our patients who are having difficulty communicating. This includes patients with traumatic brain injuries, which might be having difficulty communicating due to unintelligible speech or an aphasia, which includes having difficulty coming up with the right words to say, as well as understanding the words spoken by others. We might also be using AAC with our patients with spinal cord injuries. They might have an injury to their vocal folds as a result of their accident, making it hard to speak, or they might not be able to talk while they're using mechanical ventilation. When I say low-tech communication options, I'm referring to communication supports that are non-electronic and are generally easy to make. So for example, all of the low-tech communication options that I'm going to be showing today were either printed out or used on a whiteboard. One example of these low-tech tools are needs boards, which can look like this. This one has written words and symbols on it to help someone communicate. It can also have written words only or real photographs, whatever the patient needs for their communication issues. You can also have as many or as few cells on the page as needed for your patient. We're often using rating scales like this one. This is your general pain rating scale from 1 to 10. And we're also using rating scales for things other than pain. For example, this one has a scale from great to horrible and from very easy to very difficult. These rating scales are a great alternative to just asking yes or no or other binary questions. For patients who are often spelling out their messages, we can use alphabet boards, which can look like your standard QWERTY keyboard that someone can touch to spell out their message, or one that's set up more for partner-assisted scanning, which is a partner-facilitated communication option for someone who isn't able to touch the board to spell. We use needs lists with patients that provide a categorized list of personalized things that they often ask for throughout the day. So this can include issues with breathing, pain, people in their family that they want to talk about. And again, this creates a more efficient communication option than just asking yes or no questions, which can often lead to frustration and less efficient communication. One that we're using really often at Craig Hospital is written choice communication. For this, you'll be writing the topic that you're talking about on the top just to make sure everyone's on the same page, and writing out your choices on the rest of the board, oftentimes with this something else or other choice at the bottom in case you didn't guess their choice on the first try. This is a great option for patients who either can read or can follow along with what you've written as you read it aloud to them. The communication option that you choose will always depend on someone's specific communication needs and should always be personalized for that person. You can use these low-tech communication tools with a variety of methods. This can include direct selection, which means directly touching the item on the page that you want to talk about. It can include eye gaze or partner-assisted scanning. To learn more about how to implement these different low-tech communication tools and access methods, find more information on the Craig Hospital Assistive Tech website.